if you have any questions while we're going through this webinar and I'm showing you some of the materials, if you have any questions, you can go ahead and just, stop me and ask the questions. I can hear you from my end. You can also just put them in the chat. And at the end of all of this, when we finish, I will go to the chat box and I'll answer all the questions. If anyone wants to stick around afterwards and, ask some questions, in addition to the materials that was presented, I would be glad to do that as well. So I would like to really kind of keep this informal because it is for you guys. It's to give you an idea of what Progressive has to offer and how you might go about, implementing this in your offices. So this webinar is kind of loosely based on a one-day introductory seminar that we give periodically. And when we have an entire day, we can spend a lot more time in the details. And tonight, what I'm going to do is mostly just kind of touch on all of the topics that I think that you guys need to know and that's going to be important for you. And I think at the end, you guys will, kind of understand a lot more about, maybe the possibility of adding ortho to your office, or if you're already doing orthodontics, or maybe a lot of you are already doing aligners, adding aligners, a comprehensive, aligner curriculum to your office as well. So for me, back here, just kind of a little bit of background on me. I kind of already mentioned to you guys, I've been with Progressive for quite some time. I've actually been an instructor for Progressive for about 30 years. And I took the course myself when I was just right out of school.
This meeting is being recorded.
Okay. One thing to remember, you guys, if you would, on your end, just make sure that you guys are muted, unless you want to ask a question, because everyone else can kind of hear, okay? And I was just like you, hopefully, are going to be. I took this class in the mid-'80s when Dr. Mian first started the class, and finished the course and practiced for about a year or so, and then Dr. Mian asked me to teach. So I've been with them for quite some time. My practice style is mostly like you guys as well. Just really quick, this is the building that I practice in. My office is the one that's up here on the upper right-hand corner, and it's it's a typical office like most other people. I will say one thing, however. Just recently, in November of last year, I actually sold this office, and now what I do is I just work back as an orthodontist, a GP orthodontist in the office 2 days per week. And then obviously the rest of the time I'm with you guys and kind of helping you guys out. So what I'd like to talk to you guys about this evening, for a few hours at least, is kind of give you an idea of what Progressive is all about, who is Progressive or what is Progressive. Also, why it's important to incorporate ortho into your office. And maybe even two really, really important, questions that you guys may have, and that is, how do you learn this discipline, which is kind of a large, body of knowledge while you're practicing as a GP? And then also how to integrate it, into your office when you most of us do have a busy GP practice. Because this discipline, right, is, if you take the postgraduate study courses, is somewhere between 2 and 3 years. So to integrate it into your office as a practicing GP and to also integrate it as efficiently as possible takes a little bit of doing, and that's one of the things that we focus on when we're starting to when we're getting you guys started. If I have time, I will show you a little bit about how Progressive shows you the case studies when you are in class or when you're doing what we call the virtual classes. I won't go through an entire case because we don't have that much time, but I will show you how it's done. And then lastly, I would like to talk to you just a little bit about the economics of how this whole thing, will, work out for you. And not so much the economics of, what your production might be, but how the economics, can affect your practice and how it can affect your practice long-term, which is really, really important, right? So we'll try to touch on these this evening. A little bit about Progressive. Some of you may know a little bit more, a little bit less about Progressive. But the whole thing was started by Dr. McGann. There's a picture of Dr. McGann years ago. He graduated from UOP in the 70s and then started Progressive in the early 80s. And Progressive has really grown since then over the years. And now it's headquartered in Aliso, Viejo, down in Southern California. And at any given time, Progressive has about 35 or 40 different locations worldwide that these seminars are given in. And about the same number of instructors, kind of based all over the globe. There's some here in the States, there's some in Europe, there's some in Asia. And all of these instructors, including myself, are at your disposal. When you sign up for the course, we're here to kind of mentor you guys through and help you guys out in any way. And then a little bit later, what I'm going to do is I'm going to touch on not quite yet, but I'm going to touch on all the learning formats that you guys have at your disposal as far as the different ways that you can go about actually taking the course. Because now there are even virtual courses where you don't have to go to a seminar site and you can take the classes virtually. Okay, I will touch on that in more detail a little bit in just a little while. So I think that, most of us, it's easy to say that most of us already realize that, nowadays, you really have to be productive in your dental offices or you're going to be losing, right? Productivity in our dental offices is really, really important now. A lot of things are happening in dentistry. A lot of competition is coming in. Insurance companies are, doing their thing to kind of limit the amount of money that they are giving, back to us, on a procedure by procedure basis. So it's really important to be, as productive as we can. And having said that, there's really no question that adding orthodontics, into your procedure mix is going to be the most productive thing that you can do. We already, for the most part, most of us already do almost everything else. We all do restorative. Most of us are already doing implants. I particularly myself don't really like to do endo, so I hadn't done endo for quite some time. But we're all doing endo. We're all doing, some perio procedures. But the thing that we're not really doing, and there's a reason for that, is ortho. So adding orthodontics by far is something that is going to, add to your production value in your procedure mix in your offices. Adding a lot of value to, your office. But there's a problem with that, right? And the main problem that we have is that orthodontics really wasn't taught much to us in school. And for a lot of people, orthodontics kind of tends to be a little bit of a mystery. And the reason why is because they really didn't touch on it. They really didn't teach us that much when we were in school. And that is not because the discipline, the orthodontics, is really, really difficult. It's because they really just didn't have time. So it's become, as far as GPs are concerned, orthodontics is kind of like a, I would say a mystery. I used that term again before. It's kind of like a mystery in that since we were never taught even some of the basics of orthodontics, you get out and you tend to just say, well, I can't learn that topic, and I'm just going to refer everybody that needs orthodontics, in my office, to the orthodontics office. The reason why they didn't really teach us much in school is because they really didn't have enough time to teach us. So over the years, what happened was they just, decided that, since they didn't have time to really get into the topic, that they would just teach us how to refer. So it's not that we can't do it. It's just that you have to do it in the right way so that you learn how to do it correctly and you learn how to do it as efficiently as you can. So when you integrate it into your office, it's not such a big undertaking. And in many, many ways, it's actually really fun and, professionally, gratifying, let's say. So what I'm going to do here is I made this slide years ago, and I've been using it for, quite some time. And I'll spend a little time on this slide going over all of these things. which are the tools that you have at your disposal when you start learning orthodontics, let's say through progressive. So in no particular order, right, what I'm going to do is I'm just going to kind of start up here and kind of go around the horn clockwise. In no particular order, what I'm going to do is try to give you an idea of all the tools that you have at your disposal to learn the topic while also practicing as a GP. What tools you have specifically, let's say for progressive ortho, which are a lot, and how these things can help you kind of in a very efficient way move ortho, into your practice. So the first one is when you decide to take a progressive orthodontics course, the course is going to entail a computer software called Smilestream. And in this box, I've just labeled a couple of little headings right here. I call it, the highest level of diagnostic help, because there's treatment plans, there's a mixed dentition protocol, there's tech support in there. And when you, what I'm going to do now is I'm going to kind of take you through, Smilestream, and I'll show you just a little bit about it and give you an idea of how the software that you guys will be utilizing will be able to help you, integrate ortho into your office. So let me share the screen one more time. There we go. I'm going to ask you guys a question. Can you see my screen? No? Yassine, can you see my screen? It says Ortho Pictures.
I can see your screen,
Dr. Viviano.
Okay.
Doctor.
The reason why I asked that question is because sometimes, like we had that glitch just earlier with Zoom, every once in a while, Zoom will not give me the proper picture on my end that shows me that, you guys are actually seeing what I am seeing. So what you will be utilizing is a software, it's proprietary to progressive orthodontics. It's called Smilestream. And what this software will do for you is from A to Z, it's going to help you organize all the files that you have, organize all the records that you have, help you do the cephalometrics and the model measuring and everything that you need to properly diagnose a case. It also has treatment plans already pre-written for you. I'll show you that as well. And it is a tool that is just simply amazing, especially for people that are first starting. Because when you first start ortho, the topic is very broad and there's a lot of things to learn, in the beginning. And if you have a tool such as Smilestream that's going to help you along the way, it's very, very, very helpful. So I'm not going to touch on a lot of these things in detail because those are all covered in class when you actually start taking the class. But I will show you, some of the highlights of Smilestream and how it's going to help you, okay? So this is basically what we call the pictures, the Ortho Pictures page of Smilestream. This is just one of the things that Smilestream will do for you. Smilestream is cloud-based, so you can access Smilestream anywhere from any computer, any PC, any laptop, even your phone. It makes it very, very easy to
Instruments and
go
materials.
home and, let's say access some cases. I'm going to look for someone here. There you go. Copy is muted. And access some cases and do some work from home and do some work on the road and do some work at the office. Very, very convenient to be able to just, log in, use a username and password, and have the ability to look at any of your cases at any time. So this Ortho Pictures page obviously is where all of the photographic records and the cephalometric model measure records are going to be kept. Since it is a software, obviously you can do anything that you want with the pictures themselves, enlarge the pictures to see more or less. This is where your ceph analysis, your basic ceph analysis is going to be kept before all the points and vectors are placed. And any of the additional records that sometimes are needed in ortho, like a hand wrist film. We don't always take a hand wrist film, but the reason why I bring up this case right here is because it was mixed dentition case that needed some of these things like a hand wrist film or even what we call a frontal set. So obviously during the course, you would learn how to do all of these things, how to analyze a hand wrist film, how to place all the points in your cephalometrics and your frontal staff, how to take the pictures, how to put them in Smilestream. When they're in Smilestream, they're going to be on this page. You can access this obviously at any time. If you go over here to the left-hand side, there's a little bit of a drop-down menu. And if I just scroll over here and put my cursor, it'll say classification 1 and 2, patient expectation, and goals and limitations. Orthodontics, one of the things about orthodontics that tends to be a little bit of a sticking point for people in the beginning, I go back to the term that I used earlier, kind of a little bit of a mystery, is that orthodontics is not like regular restorative dentistry in any way. Orthodontics is something that takes quite some time to finish in most cases. So, let me find. Remember, you guys, remember to mute yourselves, okay? Look at your mute button. And the how you approach an orthodontic case is a little bit different than just a regular restorative case. There's a lot more that goes into the initial, diagnosis and treatment planning in an ortho case than the usual restorative case. So these first 4 boxes right here, if I click on any of them, an entirely new page will come up with different types of questions that are asked when you are beginning to look at a patient in terms of orthodontics. We need to know a lot of things. We need to know the classification. We want to know the curvus B. We want to know the arch shape. We want to know how many teeth are primary and permanent. We want to know a lot of different things in the beginning. We call that classification of the case. We want to know if they have a mild functional habit. We want to know what their face looks like in terms of their facial profile. We want to know TMJ history. There's a little bit of a mythology in orthodontics that has to do with, some people think that ortho in the past has caused some TMJ issues. It's a bit of a myth, and especially with modern ortho. But we do want to make sure that we look at all of these things when we're classifying a patient before we begin to make the diagnosis and then choose the treatment plan. We're always going to be looking for the patient's chief complaint. In orthodontics, if you don't solve the patient's chief complaint, sometimes they don't have one, but if you don't solve the patient's chief complaint, then the case tends to be a loser. So we're always going to ask the patient questions like, do you have a chief complaint? Typically it's going to be something like, yeah, my teeth are, crowded, or, I think my teeth stick out too far, or my face is too flat, or something. But once someone has a problem or a perceived problem, or in other words, a chief complaint, that has to go into the list of things that we need to address. And if we can fix it, that's great. If we can't fix it because of, let's say, an underlying skeletal pattern, then the patient has to know that. And it's just part of the consultation process. So the treatment preferences and the patient's chief complaint are very, very, very important. The last box when we're talking about this initial stage is goals and limitations. We're going to make a list of goals of the case. We're going to definitely list any limitations that we might have in the case. For example, a limitation might be, someone that has relatively straight teeth, but has some type of an underlying skeletal asymmetry, some type of an underlying skeletal issue that's causing their malocclusion. Well, that's a definite limitation because their teeth are already straight. And the reason why they have this, let's say, bad bite or this malocclusion is because they have some type of a bone or skeletal issue underlying that. That's definitely a limitation, and it's something that has to be discussed during the consultation process. And then definitely if there's something that you may not be able to correct, that has to be also listed in the informed consent during the consultation process. An example of something that you might not be able to correct is someone that comes in with a facial profile with a very weak or retrognathic chin, you might be able to put their teeth in the proper position within those bones, but they're still going to have that facial profile issue with a very convex and very weak chin facial profile. So that's something that you would like to correct to make the aesthetics of their face better, but it's not something that you can necessarily correct unless you do something like, let's say, orthodontic surgery to bring their entire jaw forward. So things like this, things like the goals and limitations of the case and things that you might not be able to correct, very, very important when it comes time to your initial classification and diagnosis for these patients in ortho. If you go down to this fifth box, that's the box that I just showed you. That's what we call the pictures page, or the ortho pictures. This is where you're going to import all of the pictures for your patient. Obviously, some of these are going to come from just an intraoral camera. What you see here with the right and left lateral photo or lateral picture, most of us now do have scanners. You don't need a scanner in order to do modern ortho. It is very helpful to have a scanner if you're going to be doing any type of lantern therapy at all, but you really don't need one. So this is actually a picture of a scan, which is perfectly acceptable now as far as records are concerned in ortho, because scanners are so ubiquitous now that we all use them, and there's no problem using a scanner. Every ortho case needs both a pano and a ceph. You guys will be taught all the ins and outs of taking these films properly. And then we have what's called a double occlusal model, and this, of course, is taken from your scanner, a scanner as well. This can be a study model if you would like, so you don't really need a scanner. This particular one is what you would get if you had an iTero. I personally have an iTero, so when I do my pictures, my ortho pictures, my page looks like this, right? Because my right and left lateral, screenshot is taken directly from my iTero, and the double occlusal is taken from iTero. If you have another type of scanner, like a 3Shape or a Medit, it's no problem. It's just a little bit different technique to actually get the STL files into Smilestream, but it's not a problem at all. If you go down here to the sixth box in Smilestream over here on the left-hand side, this is called the dental CAD. The dental CAD is where you're going to be taught to do all the work on your cephalometrics. So Smilestream is not going to do the ceph for you. You're going to import a blank ceph, such as this, and then you are going to be taught how to place the points. You're going to be taught how to place the structures like the teeth and the structures like let's see, start copy instead. The structures like the maxilla and the symphysis and the mandible, you will be taught how to draw those. And then Smilestream will then do all the analysis for you as soon as the points and the structures are placed. So it's really fast. It takes a little time to get used to the new nomenclature of all of these different points. But in the beginning, actually the first two seminars, you are taught a lot of all of this preliminary information on classification and how to do a ceph and what you're looking at and that type of thing. The next thing is a picture of the models. Now that picture of the models that you saw, at the end of the day, it's going to look something like this. What you're going to have is points in the models. You're going to have these vertical and horizontal vectors. This is all going to mean something to you eventually. Just to give you an example, the points that you place mesial, distal on these teeth, what Smilestream is doing is it's actually measuring the exact size of the teeth so that it will allow you to choose a wire that best fits the case. And it will actually give you what's called a visual treatment objective, or a VTO, where you get an actual picture of where the teeth are going to be moved to. So in orthodontics, what happens is you will take your lateral ceph, you will take the model measure as you see it, and it's going to make a whole series of drawings for you like this. These are called VTOs, visual treatment objectives. And it's going to show you where the teeth start, which is basically your blue, and it's going to tell you where the teeth are projected to go based on a certain treatment plan. So if your treatment plan is just to align the teeth, this is where the teeth are going to end up. If your treatment plan is to extract some teeth in this case, this is what's going to happen. That obviously we wouldn't want. So this is not going to be an extraction case. And the VTOs, orthodontists use VTOs, you will use VTOs to give you a visual, not just an intellectual, look at a case to see how you want to treat it, but actually a visual look of what's going to happen to the teeth, and it's called a VTO. You will be taught how to do all of these things, basically in the first couple of seminars. So the sixth box down here is the dental CAD. This is where your frontal ceph, you would do your frontal ceph and all of those different things. So all of the things where you're going to be placing points and then basically clicking a button down here called calculations button, and then Smilestream will do everything else for you. This is the box that you do it in. There's the seventh one down. Not much in this box, but it's very, very handy for situations like up here on the upper left. So we all run into situations in the office when the mixed dentition, when the kids come in, and they come in with either a unilateral or a bilateral. So what do we need to do when we see this? Well, we need to start thinking about how we're going to fix that crossbite. Usually that entails some type of a palatal expansion. Even in ortho now, expansion and airway and all of the things that go along with that are a very big topic in ortho right now. So what Smilestream will do for you, based on the model that you saw, it will calculate everything out for you that you need to know as far as how much expansion you need. So this box up here called the Maxler Expansion box, it will self-populate with all of the numbers once you're doing your model analysis, and it will tell you the exact number of millimeters that you need to correct your posterior crossbite. Very, very helpful. It makes your actual treatment just that much easier when you know all of these things, beforehand in detail. The eighth box down here, this is called the Cephalometrics tab. And what this does is it gives you all of the cephalometric data, all of the numbers as far as your ceph is concerned. And will also give you all the numbers for every progress record that you take. In ortho, you don't just take initial records. Often, in fact, most of the time, at some point during the treatment, you're going to be taking what we call progress records. You're going to be checking things. You're going to be checking root proximity. You're going to be checking for root resorption. You're going to be checking for torque in the teeth. And you will just import a new ceph, place some points, hit the calculations button. All of these numbers will show up for you, and it will do the math for you. So no matter how many progress records you take, even from a mixed dentition case all the way through the finish, it will keep track of everything for you. And it's very, very nice to be able to go back and kind of see how things have progressed. But this page is called the Cephalometrics page, and this is where you have all of that, data. Next one down, and this is very, very nice for, I would say, new dentists that are just getting into ortho and just starting to learn the discipline. In Smilestream, all of the possible treatment plans that you could think of, really, all the possible treatment plans that are at your disposal are already pre-written. The treatment plans are pre-written for you already, and all you have to do essentially is copy paste into your patient's file. So no matter what treatment plan or what treatment sequence that you choose, whether it's class 1 non-extraction, class 2 non-extraction, class 3 extraction, surgery case, asymmetry case, adults with missing teeth, mixed dentition, no matter what plan, it's already written out for you. So if I opened up the entire list of plans, this is just an idea of how many different plans there are and that you have at your disposal. So it makes it very, very convenient. After you decide, after you classify the patient, after you've done your records, and after you have decided on a treatment plan, downloading the treatment plan and having everything pre-written for you is very, very convenient. The treatment plans will literally tell you the treatment. They'll tell you what brackets to use. They'll tell you what wires you're going to use. They'll tell you what sequence. The treatment plans will tell you what sequence to follow. It will literally tell you what's the first wire to use and basically how long to use it. It'll tell you what to progress to, and it will really give you a roadmap for your treatment mechanics. Once you get used to doing ortho, once you've done ortho for a couple of years, all of this stuff becomes just very, very easy for you. You're still going to download a treatment plan. You're still going to get your treatment sequence. It's still going to be pasted in your chart, but it's not going to be something that you're going to rely on like you do when you first start. So it makes it very, very easy to start, right? Trying to make it as efficient for you guys as we possibly can. Another thing that throws new doctors a little bit of a curve is the differences between a full treatment case, or in other words, an adult case, and a case, mixed dentition case. And mixed dentition cases tend to be even a bigger mystery for most because there are a lot of extra things that you have to usually look at when you're looking at a mixed dentition case. Not the least of which is the fact that you're working on a child. Mixed dentition, by definition, they don't have all their permanent teeth. So they have some primary teeth left and they are still growing. So there's a lot of these things that, are additive into the plan that kind of give people a little bit of a headache when you first start. So what Smilestream will do for you is it will actually literally make and lead you into a mixed dentition treatment plan step by step by step by step. Okay, it's called the Mixed Dentition Planning Guide. And if you have a mixed dentition case, what you would do is you would download the Mixed Dentition Planning Guide and just follow all the I would say the prompts all the way through, and it will take you through the case in every way from your initial classification to your final treatment sequence. So for this case that I just showed you right here, go back to the pictures tab here. Smilestream is thinking. So for this case, right, obviously we have a mixed dentition case, which is fairly early. In ortho, I don't know if you guys remember this from dental school, but in ortho, we can estimate the amount of time that the patient still has in the mixed dentition by looking at a single tooth. And usually that tooth is the lower second bicuspid, what we call the lower five. And depending on how much of the root is formed from the lower five, we can tell approximately how many years until full eruption for the case. So for this youngster, she was only 8 years old. The root formation of the lower five, the crown is actually the only thing that's formed. So for her, she has as long as 4 years until she gets full eruption. So she has a lot of time in the mixed dentition to do whatever you need to do to align her teeth properly, and in this case, correct the crossbite, and then put her into a resting phase before all her teeth come in, and then eventually put brackets and wires on a full adult case. So for her, this is not a full adult case. This is a mixed dentition case. Now, with the mixed dentition cases, well, with every case, right? Like I said, we hate to use the word cookbook, but it's about as close to the cookbook for new doctors to orthodontics as you can possibly get. And it takes you through everything step by step by step, including what you're going to use as far as, correcting what you see. And this part in the top up here, where it says note, hi Suzanne, this is an example of the notes that we will write to you when you show us these cases. When you send us these cases to help you with consulting, and I'll get to that in just a bit, we're going to want you guys to send us your cases so that we can look at them for you, and we can make sure that the treatment is correct, the treatment design and the treatment sequence is correct, and we will send back to you more or less notations on what we see and what we change. These PowerPoint or these PDF files right here are PDF files of different techniques that we would incorporate into the treatment plan, so that when you got the treatment plan back, it wouldn't be just something that might be confusing to you. It will be a step by step plan that you guys can just take and start. So this is just an example of what we would send back to you when you guys send us a case for consultation help. The last box down here is called the appliance tab. And this tab has a bunch of subheadings in it, but basically what we're dealing with right here is you will eventually decide every single bracket, every exact bracket, the wire size, the wire shape, the wire sequence. You will design the case the way that you want it to progress. And then instead of having its huge inventory, which is very costly, you will simply just order only what you need for that specific case and only that case. And it's another way that we can make your entry into orthodontics, adding orthodontics to your office, not nearly as expensive as if you had to do it like an orthodontist does and have this huge inventory of everything. You will only have a small inventory, and it's very cost efficient. Okay, so I won't go over this page, but basically this is the design pages where everything is designed and ordered. Okay, so this is basically the software. There's a lot of other things that I'm going to kind of touch on in some of the other boxes. But as far as the software is concerned, just the pages in the software and what you'll see and kind of what you'll be dealing with, this is it. All right. Okay. Back to. So what I just did, and it took me a few minutes to do it, is the very first thing the very first tool that you have at your disposal that will help you and make your life a lot easier and a lot more and make you more efficient is the software itself. If you have any type of problems with the software, which is very rare, Progressive has a tech support department that will help you in any way. For example, if you needed tech support because you had a different type of scanner, and you wanted to know how to import those, scanned STL files into Smilestream, you could call tech support, and they have a whole list of all the different types of scanners, and they could send you the information or a PDF file on that. So there's a tech support, department that will help you, in every way possible. This box number 2, it's labeled online diagnosis, and my kind of subheading that I have for this box is no surprises, right? So in the beginning, one of the things that will give people a little bit of a headache is we want you to start cases early. We want you to start cases in your office early in the course. There's a reason for that. Number one, there's a couple of reasons actually. Number one is while you're taking the course and while you're looking at the presentations and while you're listening to the instructors and while you're talking to some of your colleagues, if you're also doing these things in your office, You're listening to somebody talk to you about it, you're studying the techniques, and you're also doing them in your office. Your learning curve is accelerating. There's no question about that. So starting these cases early is important. And there's a way that we have for you guys to be able to do that. I'll talk to you about that a little bit. But we also don't want any surprises. We don't want you guys to get into a case that might look relatively easy to someone that is not used to ortho, but in reality might be a really difficult case. So we don't let you guys, gals, we don't let you start these cases without us looking at them first. We want to see them. Even if it's just a few photos that you take without a Ceph or without a model measure, we want to see what you're thinking about, let's say starting the cases that you're starting. And we can really give you a heads up on, yes, this case is a good case for you to start. I would start it without any reservation. Or if it's a case that you should not start and maybe wait until you get a little bit more experience, we'll tell you that as well. And it's really good to know because it saves you a lot of time and energy in terms of, starting down that road and taking a bunch of records and talking to patients and then not actually doing the case. So there's a way that we have you send us the cases. There's a way that we have you preliminarily send us the photos, and we can tell you, we give you a thumbs up or a thumbs down as far as the case is concerned. And then when you do the case workup, when you add all the things that I just showed you from Smilestream, there is a way, simple way in Smilestream to just send us that case. We can have your case on our computer very, very simply within minutes after you finish it. You just send it to us via the consulting portal in Smilestream. So the way that works, okay, is like this. Now, seeing it's not giving me my green screen, so I'm going to have to ask you guys the question every time. Can you see my screen that says appliance?
Yes.
Okay, thank you. All right. Very simple way for you guys to get a heads up on a case diagnosis is just send us pictures. You can attach them to an email, send them to us, we'll give you a heads up. The other way that you can do it is a more advanced way, and it's called case consulting. So the way that this works is something like this. You can send a case through Smilestream by just clicking on the consulting button and telling us how you want to treat the case, whether you want to treat the case as an aligner case, maybe, let's say that the patient won't accept brackets and they would prefer aligners. You could send us the case for us to help you diagnose and treatment plan as an aligners case. Sometimes aligner cases are what we call hybrid cases, where maybe you would start with brackets and then finish with aligners, or vice versa. Or maybe it's just a brackets case, right? So what you would do is you would attach your case, right, to the consulting file. You would find a consultant, and there's a whole list of consultants. Oops, sorry. Let's do no right here. Kind of getting ahead of myself. Let's just say brackets. Remember, I mentioned to you guys at any given time, there's about 35 or 40 different, locations, around the world that you guys can take these. But there's also a whole list of different consultants that can help you. For instance, I'm on this list somewhere. There I am, right over here. I'm on the left-hand side. So this is me. But all of these other people that you see here, they're all consultants. They all work, with you on your cases. And you can actually send your cases for final consulting from A to Z, every detail, every I dotted, every T crossed, by just simply sending it to one of these consultants. All right. So let's see. There we go. All right. Normally, I have my long list of slides that I'm going to show you. I had to kind of pare everything down, so it's slowing me down just a little bit because in my mind, I've given the 1 days for so long that there's a lot of slides in between that I usually show. So anyway, here's the list of consultants that you have at your disposal. All of these people are like me. They can help you even via Zoom like we're doing right now. I have a lot of Zoom meetings with students. When you have a question concerning a case, we can do a Zoom meeting and we can be looking at your case and I can be kind of helping you out in real time. And a lot of the other instructors will, basically do the same thing. If you want to just get help just via a message, right? There's even a way to do that through Smilestream. So if you, on this upper right-hand side, instead of, clicking down consulting, if you just simply click messages, what it's going to do is it's going to allow you to post anything that you want. Anything that you want, and we can go back and forth in the same patient. You post a question, I post an answer. You post a question, I post an answer. Within this message system, you can also post pictures. You can, post, well, mostly just pictures, but you can even send the entire case and I can get your case and be able to look at it and help you. So not only can we do, individual Zooms face-to-face so that we can help you guys out, but we can also do the messenger. That also is a really good way of getting you guys the information that you need on a very, very timely basis at any time. Instead of having to wait and, and call somebody or email somebody, the instructors that you work with, like for instance, me, I'm always on my computer pretty much, all day long. When you post a question, I can usually get back to you within, basically, unless I'm working on somebody within, 30 minutes, 30 to 60 minutes. So even if there's a patient that's coming in later in the day and you have a question about that patient, you can simply message me and I can give you a heads up on what, basically what your question was. All right. So just go back to, here we go. So what I just mentioned to you was the second box here on how are we going to do this? How are we going to, get you guys to add ortho to your office as efficiently as possible? Well, you got a software that's going to help you out tremendously. And then you have a bunch of us, consultants that are pretty much, at your disposal, basically 24/7. And we can give you not only initial support, but we can give you continuing support. So if you need support during the case, let's say that you're 4 months in, 6 months in, 8 months in, whatever, you can simply take some progress records and send them to us, right, via Messenger. And I can have your case and I can, we can discuss the case and I can give you continuing support all along the way. One, if you haven't done any ortho, you kind of don't know how comforting that is, to somebody that's first starting. One of the things that I hear a lot when when I do, let's say 1-day intros, or, when you first start, let's say a seminar number 1, is doctors will come in and they've taken other courses. And in those other courses, they've learned a lot of material. They've learned, some ortho, they've learned some cephalometrics, they've learned terminology, they've learned, some things in ortho. But 9 times out of 10, what they'll say to me is, yeah, I learned a lot of different things, but I can't put anything together. I'm kind of lost. There's no systematic approach. And when you go to ask a question, when you go to, follow up with anything, sometimes it's not real easy. Well, one of the claims to fame with Progressive is what I just showed you. There's just a bunch of people that are working with you for POS on all of your cases that you can access pretty much at any time. And you're never kind of left out in the cold, even when you're in the middle of a case. So when you start doing ortho and you actually start getting into a case and some of these questions begin to arise, it's very, very nice to be able to simply just, send a message and have somebody look at a picture or even just, answer a question and give you feedback. So it's really, really important. The third one down, it's called webinars. So basically what you're doing right now, right, is a webinar, but an intro webinar like tonight is just the tip of the iceberg. There are all kinds of different webinars that we have. There's different webinars that we give. There's different webinars that I personally give. And just to give you an example of what that means is if when you're first starting, I do a webinar called Office Organization. So let me bring up the PowerPoint just to give you an idea of some of the other types of webinars, not just the seminars themselves, not just the materials that you're going to learn in the seminars, but other things that are out there. So for example, this is a webinar that I give on very specific office organization. And it has such things as, things that your front desk should know, how to coordinate appointments and insurance, scheduling, financial issues, how to bill, time management, insurance billing, procedure codes, dual insurance, all of these things that are really kind of tangential to ortho itself, not putting a band bracket or a wire in a tooth and moving a tooth, but actually making your life easier by giving you a bunch of information to make how you're going to organize and implement this into your office as easy as possible. So this is just an example of other webinars. Oops, not that one. Other webinars that are out there that you can access for additional information. Okay. The fourth box here, it's called PDS. PDS stands for Progressive Dental Supply. And it doesn't seem like it's a big thing, but orthodontics has its own set of instruments. Orthodontics has its own set of things, right? There's rubber bands, there's coils, there's wires, there's pliers, there's springs, there's all kinds of stuff that are very, very specific to orthodontics. Well, you can have your assistant spend a bunch of time looking through all kinds of different catalogs to try to find this stuff. Or you can simply go in Smilestream, there's a box, it's called, Store. If you click on Store in Smilestream, it will bring you to an online store. The online store is right there on the left-hand side of your screen. And it's the PDS, the dental supply, is specific for only the stuff that you need to use when you are doing orthodontics. It's not a Patterson or a Shine catalog where it has just millions of different things. It's very, very specific only for the things that you're going to need to do ortho. So, if you need bands or brackets or cements or instruments or anything like that, you will be able to find it right here. So what Progressive has done is they've made your life a lot easier, or made your assistant's life a lot easier. All she has to do is go to the online store, click what she wants on a monthly basis as you go through your inventory, and it just basically comes right to your office within the week. What this does is it saves you a lot of time, okay? And well, actually, it saves you two things. It saves you a lot of time, which is money, but it also saves you a lot of money too, because what Progressive has done, since it's just this, I would say minimal inventory, but it's only ortho. They just buy things in, huge quantities and then discount it so that you guys can go to one place and get everything you need very quickly and very efficient. So your assistants will love this. You are not going to be doing any of this stuff, but your assistants will really, really love it. The next box down here, way at the bottom, is what I call the second perspective, which is the live seminar videos. So just like this evening is is being taped for others that might not have been able to attend tonight. You guys are attending live. Others can't. This video will be available to people that are thinking about joining Progressive, and they'll be able to watch it in video form, right? So, well, not every single seminar, but most seminars are videotaped. And you can access these videotapes at any time that you want to watch, some of the seminars. So for example, if once again, if you go over here to the left-hand side of the screen, there's a little drop-down menu. One of them is called Education. So if I click that, and if I click Training, I'm going to get a whole bunch of tutorials and things that I can access to learn ortho, or to learn, Smilestream, to learn topics in ortho in general. So to give you an example of the type of thing that you have, tool that you have at your disposal as far as watching seminars are concerned, it works something like this. If you go to Education and Training, you'll be able to find a whole list of different types of seminars. The one that I clicked on, right, is an aligner seminar that's given by Progressive, and Progressive also has classes specific for aligners, very, very detailed aligner therapy classes as well. During the regular seminar series, we do touch on aligners, but it's only in terms of, is this case really, really good for aligners, or is this case not so good for aligners, and how the straight wire mechanics and aligners, can interact in different case types. But there's also a very specific aligner seminar that you can take as well, and it's a multiple day seminar. If you wanted to watch it on video, what you would do is you would just access it through Smilestream. When you wanted to watch the video, you simply access it, and these videos will be presented like this. It'll be a dual screen situation where you'll have what is being shown to the class, because these classes are all videotaped live. You'll have a dual screen. There'll be what's being shown to the class, and then the instructor will be talking to you and giving you directions. And it's just like you were in class. Okay, so if you wanted to watch any of the live seminars, if you wanted to watch some of these short introductory seminars, if you wanted to watch some of what we call the IAT, the Internet Assisted Training seminars, these seminars are on tape and video, and you can access them at any time. In fact, and I'll get to it a little bit later, one of the learning formats that is available to you is called VC, which stands for virtual class. And in the virtual class, you don't attend a class. You basically take the class via video, live video, like you're watching right now, and also videos that can be live, that can be watched, like the one that I just showed you. So once again, a tool that you have at your disposal in order to learn this topic and to really make it as easy for you as possible is your ability to be able to watch past videos and past seminars, and maybe things that you missed, or maybe you have to miss a class. Maybe there's something going on and you have to miss a class. Well, you simply take it via video and you're right back up to speed. Number 6, over here where it says your office. My little subheading right here is practical experience on your own patients. I kind of touched on that just a second ago. The practical experience that you get on your own patients, very, very important, okay? We want you to start cases as early as you possibly can. Now, one of the reasons why you can, well, there's a couple of reasons why you can. First, we're going to look at the cases and we're going to make sure that the cases are going to go smoothly for you. Number 2, we in orthodontics, put it this way. In orthodontics, a case lasts for quite some time. A typical orthodontic case, goes for about, 12 to 18 months, 18 to 24 months, somewhere in that period of time. So these cases actually last for a bit, and they go in phases. And the first part of an orthodontic case is called the alignment phase. And during the alignment phase, the only thing that you're doing is you're placing brackets in the teeth, and you're putting a really light nickel titanium wire in the arch and watching the teeth align. So if a tooth is rotated, you're watching the tooth derotate. If a tooth is flared to the mesial or flared to the buccal or flared to the lingual, you're watching that align. And the first part of any orthodontic case is simple alignment. Well, in ortho, alignment usually takes 2 months, 3 months. I mean, in the worst case types, it can take 8 to 10 months. During that period of time, you're really not doing anything. The only thing that you've done is place brackets on and place an initial wire, and then you're just watching. There's no mechanics involved. So when you first start, if we look at your cases, and if they're good cases to start, and we teach you how to place the brackets and put wires and band and bond the case, then all you're doing for the next, let's say, 3 to 6 months is just watching that initial wire, or maybe just a couple of little minor initial wire changes, align the case. No mechanics whatsoever. So you're getting this practical experience on real live patients, and your office is working on real live patients, and your assistants are learning to help you. Your front desk is learning, what to say to patients and how to answer patients. You are learning about insurance billing for ortho cases. You're learning all of these things at the same time you're actually studying in class. And that is very, very, very helpful. The next thing, okay, that is very, very helpful about starting a case early is you begin to get a return on your investment early. You don't have to wait, for 6 or 8 months or a year to start a case to begin to get a return on the investment that you're making in both money and time when it comes to ortho. So that could be, even as important as actually, learning how to do things at the same time that you're studying them. So number 6, your office practical experience, very, very important. It's one of the things that we focus on in the beginning. During the first 2 seminars, it's a focus of those seminars, teaching you everything that you need to know, from classification of the patient to how to place the bands, brackets, and wires, and sending the patient home, and just now waiting for the alignment phase to finish. That's what's the major focus of the first 2 seminars. In fact, after the second seminar in the series, after the second one, you are allowed to begin to place brackets on patients. So your return on your investment is really right away. Number 7, free retakes. What I mean by that is the way that a progressive feels about you taking the course is you become kind of part of the progressive family. So you can retake a seminar as long as you've taken it the first time. Obviously, if you've taken a seminar, you paid for the seminar. If you've taken the series, if you've taken the entire series and you graduate, you paid for your education. Well, for the rest of your life, forever, worldwide, any spot in the world, at any time, you can retake those seminars for free anywhere that you want to go in the world. That's really nice in terms of as ortho progresses and as things change and as things advance, there's changes in approach, and there's changes in mechanics, and there's changes in different ways of treating patients. And these are all incorporated into the seminars on an ongoing basis. So maybe 3 or 4 or 5 years after you finish, you feel like you want to go back and refresh yourself on mixed dentition, right? You're seeing a lot of mixed dentition cases, and you want to refresh all of the newest techniques in the mixed dentition. Well, you can go to the mixed dentition seminars for free anywhere you want on the globe forever. It's a very good perk, very, very good in terms of your ability to kind of keep abreast of things that are going on. And obviously, if you wanted to just sit in your office or sit at home like you're doing right now, let's say, and just watch that new seminar that's being taught and videoed on video, you don't even have to go to the seminar site. You just access it via video, and it's yours. So it's a very, very good perk. It helps out tremendously in, as the future goes on. Number 8, classroom. So the classroom is where the hands-on, comes into play, right? The classroom. That's where you're going to be doing. That's where we're going to be doing the hands-on. We're also going to be doing, kind of discussions back and forth. You're going to get a lot of handouts. You're going to see a lot of PowerPoints and case studies and things like that. But for the most part, the classroom was kind of the realm for hands-on. So there is a kit that you get when you sign up. Well, you have to pay for it, obviously. There's a kit of a lot of introductory materials that you need for both learning and to take back to your office and start using on real patients. Most of you are not going to have the instruments that you need in order to begin treating patients. So what Progressive has done is they've kind of put it in kit form. And when you first begin, you will buy what's called an education kit. That education kit has everything that you need to do every single hands-on procedure that's done in class. And you're going to take that education kit back to your office, and it's going to have all your initial instruments and coils and rubber bands and things. It's going to have a lot of that in there so that you can really start treating patients like, number 6. In other words, treating patients right away. Now, if you take the virtual class, okay, the virtual class, when COVID first hit a few years ago, we, as an education company, Progressive had to scramble because people couldn't go anywhere. So what we developed was all of these courses that you can take online, virtual. So for example, and I'll touch on this in just a second. For example, there is a virtual class where you do not go to the seminar site at all. It's called the VC class, or the virtual series. I personally do some of those on Thursday nights from 5:30 to 8:30. The virtual classes that we give are 30 different seminars once a week for 3 hours each. And it gives you all of the information that you get in any of the seminars. By the way, when I was talking about free retakes here, let me backtrack 1 second. No matter where you go, no matter what seminar what country you go to actually go to the seminar. For example, seminar number 2 in Sacramento, California is the same as seminar number 2 in Madrid, Spain. And it's the same as seminar number 2 in Sydney, Australia. It's the same as seminar number 2 in Johannesburg, South Africa. It's the same seminar. We're all teaching the same thing. You will see the same cases. You will hear different instructors saying basically the same thing. So you'll never get confused by someone coming in and telling you one thing, and then the next person coming and telling you a different thing. That's another point that I hear from students that have taken other classes and then come to Progressive, and they say something like, hey, I know quite a bit about ortho, but there's so many different options that so many of these different instructors gave me that I'm totally confused. Well, that's not going to happen with Progressive, because no matter where you go, the seminars are always taught the same. So if you do want to go and do one of the free retakes anywhere now and in the future, it doesn't matter where you go, it's going to be the same. Right? The hands-on is going to be the same as well. So when COVID first hit and we started doing the virtual classes with even the hands-on, the way that we do it is we just simply have a second webcam. So the way that it works is something like this. if you were in one of my classes and I was doing seminar number, well, let's say we were doing the skeletal anchored seminar. What I would do is I would have a second webcam, right? And I would turn on my second webcam, and we would do all of the exercises up close and personal, just as if you were watching it on the big screen and you were sitting in class. When we would do, let's say we would do wire bending for case finishing. If you needed to know how to bend wire during during the classes that we showed you how to make wire bends for case finishing or any other wire bend in the program, you would literally watch me, make the wire bend in, up close and this close. You would be able to see me make the bend. I would show you exactly how it's done. Then what would happen is you would show me what yours look like. So we would go back and forth and back and forth. So the hands-on, which initially I kind of myself thought was going to be maybe a little bit problematic in terms of how we were going to do it, to be honest with you, turned out to be very, very easy and very, very good. And even your ability to see it even closer than if you were sitting in class became apparent. And it was just really, really nice. So if you decided to take the class completely virtual, go back to the screen right here. If you decided to take the class completely virtual and you were doing the hands-on, that's how it would be done, right? With the second webcam. Lastly, Smilestream website. On Smilestream itself, I already showed you, when you go to the education tab, you can access all kinds of clinical videos. You can access all kinds of video tutorials. You can access literature review. There's all kinds of files on practice management and forms and just everything, all these things at your disposal that's going to make not just your life easier, but your staff as well, especially like the practice management stuff for your staff. And it's all associated with Smilestream. You simply access it through the education tab. So I'm going back to the question that I asked you, I don't know, a ways ago now. We have this topic that we were never taught in school. And so it was always a bit of a mystery to us. And in fact, over the years, it's kind of been like the orthodontists had their own little, cabal, and GPs were not allowed in. Well, that is no longer the case. Now with that aligners have come out, and now that there's a lot of different types of seminar series that you can take, like progressive, GPs are doing a lot of orthodontics. But still, how are you going to do this at the same time you're practicing as a GP and you're busy? And how are you going to integrate it into your office as efficiently as you can? And how are you going to, let's say, even teach your assistants how to do this? Progressive over here, I didn't mention it, but even the webinars, Progressive has classes where your assistants can sit and listen to somebody like me, tell them how to help you, show them everything from cephalometrics to wire tie-in and everything that's necessary for them to be able to help you right away to make your life easier. So what I did was I made this kind of circular little wheel right here with all of these different types of tools that you have at your disposal, some of which you access yourself, some of which we help you out, the dental supply to make your life easier as far as ordering. All of these things put together make your life, when you're trying to integrate this discipline into your office, so much easier. Okay. And I almost would say that you don't, it's almost, you don't know what you don't know yet. And as I've often said, and anyone that does decide to, add ortho, via progressive into their office, anyone what I've often said is, it's not so much the ortho that actually is going to slow you down in the beginning, because you're going to be taught. It's not that hard to place the brackets on in the correct position. You're going to be taught to place a wire in. We're going to diagnose the cases for you. We're going to make sure that the cases are going to go smoothly, so you don't have to worry about that. What's going to slow you down in the beginning is everything as a whole, integrating, ortho into your office, everything from how to do a consultation. What should your assistants know and what shouldn't they, what do they need to know and what do they have to know? What does your front desk need to know? How do you bill for these things? How do you appoint people for these things? What's the procedure flow? How you're learning Smilestream, because it's software, you have to learn a little bit. All of these things outside of the actual ortho are going to slow you down a little bit. So the first two seminars are, I would say, heavy in getting you up to speed and efficient in everything, not just the mechanics. Because now, when you think about joining a postgraduate ortho series, you're thinking mechanics. Well, there's a lot more to it than just mechanics. All right. Okay. Let's see. Let me show you one last thing before I go to a different one. Progressive also has, well, not Progressive, the Smilestream software also has the kind of the equivalent of a Dental Town forum. So what you're looking at now, this picture right here, is just a page that pops up when you enter into Smilestream. And what you're looking at here is posts from different doctors that are posting questions to the community. And what will happen is one of the instructors, or Dr. McGann himself, or a doctor that's been with Progressive longer than really anybody else, his name is Jeff Taylor, he will answer your questions. Someone will answer your questions from the instructor community, and you will also get posts from different people, colleagues like yourself from around the world, on a lot of these different techniques or answers to the questions that you post. So whenever you actually open up Smilestream, the very first page that you're going to get is going to be this page where if you wanted to ask a question or place a post, you could do it as well. So it's kind of the equivalent of a Dental Town type thing in terms of your ability to ask a question. Very, very helpful. So needless to say, there is a boatload of tools that you have at your disposal. So in general, how does it flow as far as the learning is concerned? Well, you can take the courses in different ways. One of my next slides is going to show you all the different ways that you can actually attend the courses. But in general, what you're going to have is the equivalent of a 2-year orthodontic post-training program. The difference is going to be from, let's say, a real university postgrad program is you do not have to do a research paper. You do not have to do any lab work. You do not have to teach undergrads. You only have to concentrate on orthodontics, how it's done, and how you're going to integrate it into your office. So you don't have to go jump through a lot of extra hoops. We're already GPs. We already have offices. We already know restorative dentistry. We're going to just add this to it, and with the tools that I just showed you, it makes it fairly routine. So you're going to be taught everything from A to Z. So when you first start, we always assume that someone has no ortho experience whatsoever. You have to assume that. So no matter if you are just starting for the at the very beginning, or maybe you've went through a couple of other courses and you've already done maybe some straight wire, or maybe a lot of us are already doing the liners and that type of thing. We'll still start from the very beginning, because there's a lot of things that you probably don't know in orthodontics as far as the real curriculum is concerned. So we will do that. You will have consistent hands-on exercises kind of throughout the entire course. You don't do all the hands-on all at once. You will, the very first hands-on that we do obviously is to place the brackets and tie in the wires on the skull and the articulator. And then it takes off from there. So you guys will make utility arches and transpalatal arches, and you'll adjust head gears, and you'll do all kinds of things hands-on wise, kind of spaced throughout the series. There's always detailed discussions, lots and lots of case PowerPoints on very specific topics, including mixed dentition. Progressive is very, very well versed in mixed dentition. There are multiple seminars in mixed dentition and mechanics, and even touching on aligners. Although if you want to know aligners A to Z, there's a separate, shorter seminar series on aligners that you can take. And then obviously you have the Smilestream software, right? The computer-aided diagnosis. So overall, that's how it flows. So when you, how does it flow as far as the topics are concerned, right? Well, this is just an example. This is a little bit old now, and it's because I have it in my files, but for the most part, it follows the basic same pattern. If you were taking the seminar series live, if you were attending every single seminar on a daily basis, it would be 12 seminars. Each seminar would be 4 days each, and you would obviously go to 12. So you would spend 48 days in class learning ortho, everything from the very beginning through hands-on, through even skeletal anchorage. So the progression of how your learning curve goes is something like this, right? In seminar number 1, very, very heavy into, hey, how do I clinically evaluate, a patient? How do I take records? What do I say to them as far as the first consultation is concerned? And we're trying to get you guys prepared to start looking at patients in terms of orthodontics. We look at them in terms of perio and TMD and restorative, but we need a kind of a paradigm shift in terms of getting you to look at patients in terms of ortho. Right? So seminar number two is, obviously in seminar number 1, the computer Smilestream is introduced, but then in seminar number 2, you really get into the Smilestream software and dental VTO predictions, second consultation, and how to put on the bands, brackets, and wires. At the end of seminar number 2, these first 2 seminars, you will be ready to begin treating patients. When you go to seminar number 3, now we start, it says banding and bonding. It used to be in seminar number 3. Now it's in seminar number 2. So don't take, if you're taking a screenshot of this, don't take it to the bank. We have different types of, we're starting mechanics, right? Now we're starting to move teeth. What's going to happen? How do you move teeth? What do you use? Seminar number 4 completes that. Not complete it, but it continues that. Alignments, mechanics, intro to finishing, all kinds of cases that you see. This is called the first section, right? The first 4 seminars, the first section. The second one, seminar 5, 6, 7, and 8, you get into class 3 cases, then you start getting into mixed dentition, and there's several seminars that have to do with mixed dentition. Several seminars, very, very detailed mixed dentition diagnosis and treatment plan. Seminars 5 through 8. Section 3, the last section, the last 4 seminars. Now we start getting into the much harder case types. Now you've been studying ortho for a while. You've seen a lot of cases. Hopefully you've started cases in your office. You've already started mechanics. Now what we're going to start showing you is all the more advanced type of procedures. Orthodontic surgery cases, skeletal anchorage cases, asymmetry cases, dental mutilated cases, all kinds, or TMD cases, all kinds of different case types that are the higher level. You don't get those until you're ready, which is at the more towards the end of the series, and you've already been studying for about a year or so. So So I'm not going to spend too much time in the next couple of slides, but I think it's really important, especially for you that might be listening right now, to understand what the difference is between what you might have learned before. You know, I'm not going to throw anybody under the bus, but let's say USDI, right? USDI gives you a lot of information, but it gives you kind of the information in a kind of a piecemeal type situation with different instructors sometimes saying different things and having you do different things in different ways. Progressive is not going to be like that. And that's one of its claims to fame. It's a systematic approach. And when you finish, when you get to seminar number 12, I mean, literally it says putting everything together. I mean, when you get to seminar number 12, you know ortho. You know, you may not have started every single different case type, but you know, and you've seen multiple times how to do each and every procedure, you know, in ortho. So the thing about, you know, progressive that really gives people, puts people at ease is the fact that it's reproducible. So it's systematic. We're going to teach you how to do orthodontics, and you can take these techniques and you can take them to your office and they can be reproducible. If somebody tells you how to do something and you take it to your office and it doesn't work, that's no good at all, right? So it needs to be reproducible. You need to be able to do it, and you will be able to do it. There's no problem with that. There's a ton of support, like I mentioned to you guys before, even Zoom one-on-ones like we were doing right now, where we can just go back and forth and ask questions. It's very systematic. You can take any course anywhere in the world. You're going to hear the same thing. All right, software, modern. We have the email diagnosis that you guys can, for your entire career, if you want, you can send cases for consultation help, right? Technical support. I'll touch on this in just a second as far as the different course availability. The dental supply makes your life a lot easier. The forum I just showed you, where you can post questions. Lots of update seminars. There's actually a yearly update seminar where one of the instructors will give a 2-day course in everything new in ortho, or everything that needs to be maybe talked about, newest thing on the block. It's called update seminars. Very, very nice. Kind of keeps you up to date. And then of course they have assistant seminars. So if you don't want to teach your staff, if you want POS to do it and make them very, very efficient and help you, well, POS can do it. You can send your staff. You can go as well, but you can send your staff to a 3-day training seminar, and they'll teach them everything that they need to know to help you. Right. All right. As far as the formats are concerned, as far as your ability to take these courses in different ways. The one that's up here in the upper left, that's labeled in person. Okay, the picture here, that's Dr. Dana. He's the head of curriculum for POS. He's the fellow that you saw that I kind of downloaded for that aligner little demo. He's not the only one that gives it. We all give in-person seminars. But if you take it in person, okay, what you're going to do is you're going to attend the full series. So you're going to take 12 seminars of 4 days each. They're in person. And you're going to hear, right? You're going to hear one of us go through all of the PowerPoints. We're going to take you through all of the hands-on exercises. We're going to take you through the computer exercises, and it's all going to be done in class. And give or take, maybe about every month and a half, every 6 to 8 weeks, you will attend one of these Friday through Monday, Friday, Saturday, Sunday, Monday, 12 different times. That's the full series. That's the traditional series. That's how it was taught from the beginning. The one that's on the right-hand side, it says IAT hybrid. Years ago, when computing power got to the point, and I guess you could say our ability to send and receive information, not just the old dial-up that I remember when I was a lot younger. It became, we had the ability to be able to do some of this offline, right? So the IAT hybrid is exactly the same material, exactly the same. It's just you don't have to go as often, and you yourself at home, self-study at your convenience, watch and study the, some of the PowerPoints, not all the PowerPoints, but some of the PowerPoints on your own time. So instead of, as an example, the way that it would work is this. Instead of Dr. Dana sitting in front of the class and having his clicker and showing you, slide after slide after slide in PowerPoint, and having a verbal discussion of, hey, this is what we're doing, and this is what you're seeing, and this is the problems that are associated with it. Instead of somebody standing up in class and telling you, if you're doing the IAT hybrid and you're doing some of this self-paced at your own time, you're looking at the same PowerPoint, but instead of somebody telling you, it's written out for you. So the same thing that we would normally say to you regarding a specific slide, like let's say that there was a slide that something went wrong and some of the mechanics were inappropriate. So we wanted to show you what could happen if you did inappropriate mechanics in that situation. So instead of telling you about it, you would see the slide and then you would just read the same narrative. It would say, hey, this is what happened, this is why, and this is how we could correct it. And you would just read it. So the IAT hybrid, you don't have to go 12 times. You only go 4 times. And each time you go is just 3 days each. So you go Friday, Saturday, Sunday. So the total number of days that you sit in class for the IAT hybrid is 12. The in-person is 48. The IAT is 12. So obviously with the IAT, when we are there, it's going to be a little bit more hands-on because all of the hands-on exercises are within those 4 3-day seminars. We do see PowerPoints. We do a lot of the same things that they do in person. It's just the PowerPoints that you're going to study, and even some of the files that we send you to study, you're going to do on your own. It's called the IAT hybrid. It's a good, their description of it is the best of both worlds. It's a good way to still attend in seminar, ask, live seminars, ask any question that you want, do live hands-on training. It's still a really good way. It's just you don't have to travel as much. So the difference between those two in many respects is if you are a person that really enjoys sitting in class and having that interaction and learning when you're there versus maybe a person that prefers to do it on your own time, or maybe you think that you can do it on your own time, but you find that you don't because there's nobody there to, kind of push you into, doing some study, let's say. You are either one of those. You're either an IAT person because you enjoy working on your own a little bit and you don't feel like traveling as much, versus the other. So the IAT hybrid is given throughout the world, just like the in-person training is. And that's another way of taking the seminar series. Same information. The one that's in the lower left-hand corner, virtual classroom, that's the one that's completely virtual. The way that one would work is exactly the way that we're doing it this evening. Right now, I am in my office at my house. In fact, behind me is a whiteboard that I use to move teeth around just as if we were in class. I can draw, on the whiteboard. I can, do anything I want. We can converse back and forth. If you have a question, you can ask a question. I can go to a different PowerPoint. I can show anything we want. It's exactly like you're in the classroom. It's virtual, and we're doing it, via Zoom like this. When we do the hands-on is also virtual, just like I showed you. We're going to do it with a second webcam. The last one is on the lower right-hand side. That's called self-paced. The self-paced is where you can study all of this stuff yourself at your own pace. And what you'll do is you'll have a mentor. Let's say me. I'll just use me as an example. So if you wanted to do the self-paced, you would have access to everything that everybody else has access to, especially the videos of the seminars. So you would be watching the videos of the seminars just like you were there, and then at your own time, self-paced. And then when you have any questions at all, you would have a mentor instructor, let's say like me, and we would go back and forth. You would send me a case, I could critique a case for you, we could go through Messenger, you could ask questions. It's exactly the same as any of the other learning formats. It's just self-paced, and you're watching everything, via video. You're not attending a virtual classroom live. You're not attending the IAT, live. You're certainly not in person, attending those 48 days. What most people do now, since we have all of these different types of learning formats, what most people will do is these other formats, the in-person and the IAT and the virtual, they don't start on a monthly basis. They all don't start on February, and then another one start in March, and another one start, in June. They start in different places in the United States and around the world at different times. So you don't necessarily have an in-person, starting at any time soon near you. So what you would do is you would begin self-paced. You would sign up for Progressive. You would do everything that everybody else is doing, but you would be self-paced. You would have a mentor that could guide you through as you're watching the seminar videos. And then if you wanted to, if there was an in-person class that you wanted to attend somewhere, if there was an IAT that was starting that you wanted to attend, or if there was a virtual starting that you wanted to attend, you would simply then go into and become a member of that class. Or you could stay self-paced throughout the entire series if you wanted to. What I find is that what most people will do is, if you wanted to start, let's say tonight, right? By tomorrow or by Monday, you would have all these tools at your disposal. You would have access to Smilestream and everything. You could actually begin studying self-paced. And I don't have my calendar with me here, but I believe, well, let's say the next virtual classroom that I'm going to do is going to be in October. So you could do self-paced with a mentor until October, and then you could join the virtual classroom if you wanted, right? So that's the way that it would work. You begin regardless. You begin self-paced, you start studying, and when a class forms that you want to actually attend, whether it's live or virtual, you just go and you attend the class. So these are the 4 ways that you can take, and it makes it very, very convenient because there's so many options on your ability to, learn the material. Right, just for fun, right? I put a couple of these slides in there just to kind of give you an idea of how this, this whole thing, is going to work for you. A picture, this is Dr. Taylor, this is Jeff. In the beginning, seminars 1 and 2, everybody has Smilestream, everybody's got their laptops open. He's up at the front, taking you through all the exercises. I'm up at the front taking you through. You guys are, following along. We're coming out and, showing you and helping you out throughout the process. When it comes time for hands-on, we have, this is what you see right here as far as the skull and the articulators and the instruments. This is part of the ed kit, right, that you would get so that you could actually partake in the hands-on. Another picture, what we do is we have you guys place the metal brackets on the skull, and we have you place the porcelain brackets on the typodont, so you get a chance to see both metal and porcelain, and tie the case in and make utility arches and do all that stuff. So these pictures are just pictures of people in class, doing the exercises that you guys would do as well. If it is in class, we would be doing live demos like this. I would do something, I would show you exactly how to do it. Then you would go back to your desk and follow along with me, let's say on the screen, or I would walk around and we would talk about it, and I would watch you guys do it. There's even the ability for you guys to go to different offices to actually watch us do watch us do procedures. I used to do this. I used to have doctors come to my office and I would put all kinds of different procedures during the day, everything from an initial bracketing to, let's say, a skeletal anchorage. And they would stay with me the whole day and I would do all of these things. And at the end of the day, they would have had a chance to see all the stuff. I personally don't do this. I stopped doing this because, I don't know, it became a little bit cumbersome for me. But I will say this, now that I'm only doing ortho and ortho only, I'm thinking about doing this again and having, putting it out there where if you wanted to come to the office, I could show you different procedures, you know, let's say all day long, a lot of different types of procedures. Okay. How much, right, is your investment in this process? Because it's a big, you know, issue. How much is your investment? Well, I just put C handout, C handout. What I want you guys to do is, Amalia will, you know, send everybody all the information as far as all the costs and, you know, how much it costs for the seminar series and how much it's basically going to cost you to kind of equip your office for ortho. It's exactly the same as, you know, when you weren't doing implants and you decided to do them, you had to buy a certain number of instruments and a, you know, an implant motor, and you had to buy, you know, some abutments and some even call. I mean, you had to get some stuff. Ortho is the same way. You have to get some stuff in order to be able to practice. And Progressive makes it pretty easy for you, you know, by giving you a kit. And the first one that you would get would be the education kit. So they will send you the information. In fact, they might even be posting it in the chat right now for you guys. But what I really want to get to, as far as, you know, how much is the investment, is not so much how much is the investment that you're going to put in money-wise, but a couple of questions that are over and above that. And this is where it really starts to get interesting, and it's actually kind of fun too. The first thing is, you have to ask yourself, how many ortho cases are you referring out of your office every month? So even at, you know, you know, because I'm an older guy, you know, I was never a PPO person. I never took any plans. So I had only two fee schedules. I was either Delta Premier or fee for service. So my fee, even my Delta fee, was $5,500. Excuse me. My fee for service fee was more like $6,000. But even if you're a PPO, that's still Delta PPO, let's say, is still $3,800. So how many patients are you referring each month? Because each one of those patients at the end of the day is worth somewhere between $3,800 and, you know, let's say that you're Delta Premier, and $5,000. So it's kind of fun, because when we do this, you know, if you were sitting in class, I would literally ask you, I'd say, okay, how many are you referring? And some people would say 2. I'll go, okay, well, you know, you're referring anywhere from, you know, $8,000 to $10,000 a month out of your office. And literally, some people that have really, you know, busy offices would say outrageous numbers like 10. And that, you know, I just have to look at them and I would say, okay, even at PPO fees, you just referred out of your office $38K in production, and you're putting in the pocket of, you know, your best friend, which is your orthodontist, right? So you have to, when you're talking about what is your investment, you also have to talk about what you might lose if you don't, you know, eventually do this. Okay, now what goes along with that is that those are only the cases that you know need ortho. I can guarantee you, it's guaranteed, I would be able to bet a large sum of money that when you start learning real ortho, the way that, you know, it's taught, orthodontists are taught, whether, you know, the way that Progressive is taught, you're going to notice that there's a lot of cases that you didn't recognize. There's a lot of cases that should have been treated and went untreated because you didn't recognize that it needed to be, or you at least didn't ask the patient the question. Basically, you know, are you interested in ortho, you know, to correct your bite? So how many cases go untreated that you actually don't recognize? I can guarantee you that there's a few that are slipping through the cracks. And well, and then the last one, how much of this production is being basically referred or really lost. So there are a couple of slides. I'm not going to spend a lot of time on them because they're pretty self-explanatory. But how many cases do you need to begin in order to pay for your entire education and the supplies that you need? In other words, the stuff that you need in order to really start actually treating patients. How many patients do you need? To cover your entire investment? And it's actually pretty low. You need somewhere in the neighborhood of about 7 to 8 real, honest to goodness paying patients. And that's it. You have covered your entire expense of your entire education, all 12 seminars, all IT, whatever you're taking, plus the supplies that you need to equip your office to actually start treating patients. So it's very, very, there's not that many people, there's not that much, you don't have to treat a lot of patients to actually recoup and to start really gaining that return on your investment. All right. Now, the slide that I personally like the best when it comes to the economics of this whole situation is this one. So I made this slide years ago. I've been using it. So it's a little bit, once again, it's a little bit outdated especially for PPO people, because this is based on, it's assuming 5,000 per case. So you can look at these numbers in terms of, let's say, if you're a Delta PPO, which unfortunately most people are now, a little bit, less, not a lot less, but a little bit less. So if you go to the left-hand side of the screen where it says cases per year over here, where it says 10, 20, 30, 50, that's just a list that is the total number of cases that you could be doing on a yearly basis. So if you equate that to a month, if you're only doing 10 cases per year, that's less than 1 case start per month. Even then, at the end of the first year, even then, you've added somewhere between 38 and 50,000 to your bottom line. Okay? If you're only doing 10 cases per year, you absolutely don't even feel that on your schedule. I mean, it doesn't even exist. In fact, we like to say that 10 cases per year is really only a hobby, and you're only doing it because your brother-in-law wants you to do his braces, and he doesn't want to go to anybody else. It's just, you're not even doing any ortho. Let's say you bump it up to 20 cases per year. Well, if you do that, you're starting about 1.5 cases per month. You're doing the workup, you're doing the analysis, you're doing the bracketing and the tie-in on about 1.5 cases per month. You are still not feeling that on your schedule, because in modern orthodontics, the appointment intervals that you're going to use are not on a monthly basis. In modern ortho, the appointment intervals are usually about every 2 months, not every month. So if you are treating about 20 patients per year, you're really not feeling that in your schedule. Yet, at the end of that first phase, I'd say first year, you've still added about 100K to your bottom line. And at the end of 5 and 10 years, you've added 500 and $1 million. Even only doing 20 cases per year, which is really not that many, right? Orthodontists do hundreds and hundreds of cases per year, hundreds and hundreds and hundreds. And you're only doing 20, and you're still being fairly productive. So now let's say you start getting into 30 to 50. Well, if you start 30 cases, that's about 2.5 per month. At the end of the year, you've added about 150K to your bottom line. And if you get up to 50, that's one a week. And if you're doing one bracketing a week as a GP, I personally consider that pretty good. I mean, there's a lot of docs that I work with that do way more than that. I mean, way more than that. But 50 cases per year, or working up and actually starting 1 case per week, especially in the first, let's say, 2 to 3 to 4 years, let's say 2 to 3 years, I think is a pretty good number. And at that, even after, on a yearly basis, you're adding $250,000 to your bottom line. And at the end of 10 years, you've added 2.5 million. So just consider, if you have 10 cases per, If you're referring 10 cases per year or 20 or 30 or 50, this is basically what you're putting in the pocket of the orthodontist that you're referring to. Okay. If you go over here to the right-hand side, potential lifetime income. So here I said cases per year, let's say 30, 40, and 50. If you look at the total revenue that these cases will bring to you, if you do it on a yearly basis at the end of 10, 20, and 30 years, it becomes very, very significant. So for those of you that are younger and are just out of school and haven't been practicing for too awfully long, I mean, I just sold my office after, I mean, I graduated in 1983, so I sold my office almost like 39 years. So I'm way past even 30 years of doing ortho. But if you are early in your career and you start doing 30 cases per year, just on an average, at the end of your career, say about 30 years from now, you know, you're going to be 60-ish, you just added about 5 million to your 401k. And if you do get up to that one time per week, if you average, you know, that, which a lot of doctors, you know, end up doing, at the end of 30 years, you just added 7.5 million. So this is not insignificant amounts of production that you are giving to someone else. Now, like I said, kind of going back to almost back to the future, it's one thing to learn how to do it, and it's another thing to learn how to do it and be efficient at it. You need to learn how to do both. And that's what we are here for you guys to do, to make it so that not only do you learn how to do ortho and you're comfortable at it, and you have a comfort zone. So when an ortho patient comes in, it's not like you're, you know, scrambling to, you know, get your, you know, notebook out. That will go away really fast. But you're also efficient at it. So everybody in your office is helping you, from your hygienist all the way to your front desk. And all you're doing is having a nice, easy time walking around with your hands in your pockets and hopefully just telling your assistants how to do it. We all know, well, we all don't know, but most of us do know, we either had ortho ourselves or maybe our children have had ortho. You know how an orthodontist office works. An orthodontist office works like multi-chair, and the orthodontist can walk around and look at cases and decide what to do, and then tell his assistants to finish. Let's change this bracket, let's do this wire change, let's add this coil, let's do this, let's do that. And his assistants actually do a lot of the work. So that's the way we want to approach eventually, you know, you doing your ortho as well. So you have these highly trained assistants that, you know how to do it, help you. And then you just walk into an operatory and look, decide what to do, and, you know, basically, if your state board will allow you to, have them do the bulk of the work. I know for a fact now that I have been doing only ortho for, you know, the better part of about 4 or 5 months. It's way easier than what you are doing now and what I used to do, which is a lot of restorative and a lot of you know, different types of procedure mix on a daily basis. Now I just walk around with basically kind of sort of my hands in my pockets, and I tell my assistant what to do. It's really, really nice. Okay. Now, not only, you know, are you kind of sending a lot of this production out of your office, what you don't know is it's not just the ortho that's going to increase your production. When you start adding ortho, there's a lot of other things that start to add into the procedure mix. So I made a little chart right here as far as, you know, some of the things that you kind of are not thinking about, and that will, you will see more of these procedures by far once you actually start doing ortho. So in general, the way that this works is you're going to be doing a lot more about your cosmetic kind of whitening department, that type of thing, because your assistant, or excuse me, your patients, now that their teeth are straight, they're going to want their teeth to be look really, really nice. So not only are you going to be doing the easiest cosmetic stuff like tooth whitening, You are definitely going to be doing more cosmetics as far as your crown and bridge is concerned. There is no question about that. You're gonna place these people's teeth in the proper position, and then they're gonna want those teeth, if they don't really look good or they're not the correct shape or they're not the right shape, they're gonna want a lot more restorative done in those teeth. So that also will increase. You're going to increase the amount of TMD and TMJ splints and diagnostic splints that you are going to use in ortho, because you're going to have different types of patients come in. You're going to have TMD patients come in that think that they need just that type of therapy, but the reason why they have their head and neck pain is because of their malocclusion. So the ortho is going to come first before the definitive, let's say TMJ treatment. So you're going to do a lot more TMD/TMJ type treatments. If you get into that, right, if you get into TMD and migraine, you're going to be able to do Botox. Now this is state by state, but now most states are letting us do Botox for true migraine and TMD, not cosmetics. Here in California, we can't really do it for cosmetics, but we can certainly do it for TMD and migraine, and I actually do quite a bit of it. You're going to do many more implants because you're going to align the teeth to a better position, and your implants are going to look and be placed in better spots, in better positions. So your implant/restorative department is going to increase as well. You're going to have a slew of different type of orthodontic surgeries. Probably the most common of those is going to be impacted teeth, typically impacted canines. We will teach you how to do canine impaction surgery, canine retrieval, how to attach to a tooth, impacted tooth, and bring it into the arch. That is not part of the regular ortho fee. That is an add-on fee. There's a CDT code for it. And let's say a typical $5,000 case is not going to be $5,000 case. In my office, I charge $850 for a single canine, and I think I charge $1,250 for two. $850 for one and $1,250 for two. And I for whatever reason, I've done quite a few over the years, many. There's all kinds of other associated surgeries that are orthodontically kind of related. You're going to be doing more perio because you're not going to be doing any ortho on perio patients that actually need ortho. You're going to be doing skeletal anchorage techniques for the most advanced case types. That also is not included in the standard fee. My fee for skeletal anchorage, let's say for gingival display correction, gummy smile correction, you're going to place 2 bone plates right at the piriform rim. We'll show you how to do all of that. I charge $1,500 for that. So that's over and above. You're going to have an increased referral base. So as soon as you start doing this, people are going to recognize that you do it. You're going to put some brochures in your office and stuff like that. And you're going to get more and more people asking you to do it rather than assuming that you don't and just automatically, going to, let's say the orthodontist down the street. You are definitely going to be doing more aligners because you're going to be able to recognize all of the case types that are best treated with braces and all of the case types that can be and maybe want to be treated with aligners. So you will be doing more, even aligners, when you start doing straight wire. It's kind of counterintuitive, but you will, believe me. You will be doing more in some limited treatments. These are the people that come in that had ortho in the past, let's say, and now they have some upper or lower incisor cut. And all they don't want full ortho anymore. They just want some cosmetic realignment. So you will be taught how to do limited treatments, not full treatments. So the fee is not going to be a full fee. It's going to be a limited fee. And in my office, more or less, I charge about $3,000 for a limited treatment case. Right? Laser gingivectomies, you're going to, once again, people are going to want better looking, teeth. And you have someone that comes in with really short, stubby teeth that has altered passive eruption. You can do a cosmetic gingivectomy and, do the ortho, align their teeth, and then a cosmetic gingivectomy, and they look really, really good. And then, retainer replacements are free. So at 10 years from now, you're going to have hundreds and hundreds and hundreds of people that you're probably going to want to, many of them, maintain their retainers, and then retreats. So you're going to have a whole list of different procedures that are going to be associated with the fact that you're also starting ortho. And the combination of the two is very, very productive for you, for us GPs. And at the end of the day, right, what you're going to want is you're going to want to, I don't know, for lack of a better term, start a smile club so that you can put it on your website. And, everybody that comes through, regardless of whether they're just a little one, like, let's see, the littlest one's probably this little gal right here. Who knows what's going on? I forget. Her lateral incisors were blocked out or something, to people that are, let's say, older, like up here in the upper right-hand corner. You will, when you start recognizing the need, and you simply start asking the question, have you ever considered orthodontics? You would be surprised that the people that, especially now that we have, our dual track, we have both braces, we have cosmetic brackets, we've got clear porcelain brackets, they look spectacular. And then of course we have aligners. We have a lot of tools that we can give to people, even if they hadn't previously considered ortho. And you would be surprised. One of the things we talk about in the beginning when we begin to take you through the consultation process and how that works and what to say and how to proceed is you would be surprised if you just simply ask the question of your patients. Have you ever considered, straightening your teeth? And then that opens up the conversation, and the next thing you know, you have an ortho case. So this is where you want to be. Well, actually, probably this is where you want to be eventually. So for you guys for this evening, that is pretty much what I wanted to show you guys, kind of touching on a lot of different little, topics. So now I'd like to open it up for questions. Let me go through the chat, because there's probably a lot of questions in the chat that you guys don't have to answer, and I can just read them and look. Okay, so the first question is, how do we choose a consultant? You can choose a consultant. You can choose any consultant that you want. So all you do is there's a little icon in the upper right-hand corner of Smilestream, and it's a little head. And when you click on that, all the list of consultants come up, that page that I showed you with all the different consultants. Everybody that you see there is worldwide. There's some that are based in Europe, and there's some that are based in Asia, a lot that are based in the United States. You can choose any consultant that you want, and how you choose them is you simply click on that icon, and that entire list will come up for you. The second question is, do you keep software with all the videos? With all the videos you can watch even after you are done with the course? You can, when you're done with the course, you have access to all of the videos that there are, right? You have access. Well, let me backtrack on that. POS gives courses other than just straight wire. For example, if you took the aligners course is a 12-day course. It's 4 seminars of 3 days each. That is not included with the the standard ortho course, the straight wire course. You would attend that, and you would pay for that. If you did, you would have access to all of those anything that was associated with the aligner videos as well. But I would say this, for the most part, I'm just throwing this out there, but I would just estimate that there's probably about 90% of everything that you see during the entire course, you have access to for your entire career. You've taken the course, you've paid for the course, you're part of the progressive family, you have free retakes forever, and you have access to all of those previous videos as well. Okay. Let's see. That's correct. You will have access. Okay, so that's an answer. Oh, it's Yassine and Amelia answering some of these for. I wonder should I? Let me go through some of these that aren't you guys. Okay, question. How often do retreats happen? Isn't it ideal to shouldn't happen after successful ortho treatment? Retreats. So this brings up the concept of retention. So retention is part of ortho. Orthodontics is not just placing a bracket, moving the teeth into the right position, and then letting the patient go. Retention is the very last phase of ortho, and it's integral to ortho. We spend a lot of time on retention. There's a lot of different types of retainers. There's a lot of different ways to retain. There's the clear retainers, there's the hollies, there's the bite splints, there's the fixed retainers, the upper and lower 3-3 retainers. There's all different types of retention. Each type of retention is good for a certain type of malocclusion. And the answer to your question is retention is a big deal in ortho. And what I like to say to doctors when we start talking about retention is, just because you have braces between the ages of 10 and 12 years old doesn't mean that your teeth are automatically going to stay straight until you're 62 years old, right? That's 50 years later. And during that period of time, we can't hear as well, we can't see as well, we can't run as fast, we can't jump as high. Our skeleton, we're not even as big as we were. Our entire skeleton has changed. So it doesn't make any sense to think that just because you straighten somebody's teeth and you put them in the right position at 12 years old, that they're automatically going to stay that way their entire life. It doesn't happen. In ortho, it doesn't happen that way. So retention is a big deal, and we spend a lot of time on it. And patients that really, really want to retain their teeth in the best possible position, typically they'll still wear their retainers at least one time per week, and they'll just pop them on at night. So, a Saturday night or Friday night or whatever it is, they'll put their retainers in, and they'll just make sure that the finish that you got when you were 12 is keeping finished at 22 and 32 and 42. So how often do retreats happen? It's not a lot, because we will teach you how to talk to your patients and make sure that they understand that retention is important. And most of your patients will take that, to heart, and they'll wear the retainers quite well. Next question says, can we access Smilestream software full function with some kind of payment without seminars? Yes, there are all kinds of different payment schedules that and discounts and all of that type of stuff that are associated with how much the actual education costs. So I'm not the one to ask as far as those questions are concerned. So Amelia and Yassine are much better prepared to give you all the details on the costs, and they will definitely, anyone that wants to simply give them a shout out. Or Yassine or Amelia, would you like to talk to them right now as far as that goes? And maybe
yes, they can message me or email me, whichever is easier for them, with any questions that they have regarding pricing or anything, and I'll get back to them.
And the reason why is because there's a lot of different options that you guys have as far as the cost of your education, right? You don't have to pay upfront and full, and that's it.
And also so many discounts as well. So we want to work every case separately to make sure you get the best out of your tuition.
Yeah, there's a lot of different options. So get in contact with Amelia, and she will give you all the options, and they will work with you as far as that goes. Okay. Does Smilestream Ortho software have regular updates on new consultants and new orthopedic plans? And how often does that happen, in a month or in a year? Does Smilestream update? Well, Smilestream, the software people behind Smilestream, they do make adjustments to Smilestream on a regular basis. How often are there updates or new treatment plans? The treatment plans that you have already written in Smilestream cover every possible ortho scenario that there is. There are no other possible ortho scenarios that are not covered already by the treatment plans that are written. There's over 150 different treatment plans already written out for you. Having said that, if there is a new technique, if there's a new gizmo, if there's a new wire, if there's a new progression, if there's new anything, Dr. McGann and the like David and Dr. McGann and another instructor, Jeff and Shock, they will look into those things and they will implement all the newest techniques, into the treatment plans, because they can do that behind the scenes. The software people can do that at any time. All right. So yes, it is updated, but does it need to be updated on a regular basis? No, because it's already so complete that it doesn't really need to be. Okay, how many times do you go to the Learning Center with each classroom format? So you would go to a seminar site. If you were taking the live seminar series, you would go 12 times. Each time you went would be 4 days. And those are given all over the globe, right? You can access the worldwide schedule. In fact, they will send you the worldwide schedule and you can see how many different places over the globe that these are given. If you do the IAT, the Internet Assisted Training, you only go 4 times for 3 days each. Instead of 12 times, you only go 4 times. If you do the virtual, you go 0 times because it's all virtual. And then obviously, if you're doing self-paced, you start self-paced and then you either stay self-paced or you go to one of the other seminar sites if you want. You don't have to. All right. If I'm not answering any of these questions completely for you, go ahead and post again, because I'm just going down the list right here. Okay. How long does Progressive Ortho provide support after the program is completed? Forever. Progressive Ortho provides support forever after you complete the series. There is no time limitation that it does not support your ability to ask a question, post a question, get consulting help. There's no. And obviously, as I mentioned before, it's a free retake policy for any of the seminars as well. Let me read. This is a longer one, so I'm going to read it here myself. So does Smilestream software have a post-ortho treatment image of the treatment outcome? Well, that's the VTO, okay? The VTO is what gives you a post-treatment outcome. It does not have the equivalent of, let's say, a ClinCheck from Smilestream or SureSmile or ClearCorrect. It doesn't, do the 3D morph or anything like that. However, I will say this, since I have an iTero, I personally am an Invisalign guy. I prefer Invisalign. I use Invisalign mostly. So it's the easiest thing in the world for me. I mean, I can do an Invisalign simulation. And to be honest with you, the patients don't really know, from A to Z how their teeth are really, going to end up. So if you simply give them the Invisalign simulation, if you have, an iTero, let's say, they think that, this is the greatest thing since sliced bread. Even though the treatment that you might do would be a little bit different, when you are actually doing it. But the answer to your question, no, there's no 3D simulation. I would suspect that maybe someday there might be some type like that. I'm not sure on that, but I would be willing to bet that probably the computerization and the coding behind something like that would need to be pretty sophisticated. But the simulation that it does give you is called a VTO, and that's what most orthodontists use. They just use the VTO. Right? Okay. Got it. So can you give your opinion on traditional metal braces versus self-ligating braces, i.e. like the Damon system? It's really an interesting question because there's been so much money, advertising money, poured into the Damon bracket system by Ormco that it's like any other marketing technique. They've poured literally tens and $100 million into over the years promoting Damon self-ligating bracket system. Damon bracket system is not the only self-ligating bracket. Everybody, GAC, American, Ormco, everybody has a self-ligating bracket system. The only difference between a standard bracket and a self-ligating system is in a standard bracket, you have to put a steel ligature tie or a rubber band to hold the wire in place. So this answer to this question, we could spend a lot of time on. And in fact, as part of the mechanics seminars, we do discuss the differences between self-ligating brackets and regular brackets. Now, having said this, what you need to do, if you are interested at all in the differences between the Damon self-ligating bracket system and regular brackets, simply go to the Ormco website, because Ormco makes Damon, and you click on the Ormco website, and on the top toolbar, you'll see all the normal stuff, home, about us, and everything. You will see the term Damon. When you click on that, it'll bring up the entire, barrage of all the things that Damon has to offer. So if you read down the list, it will say fantastic things about Damon and how good it is and how well it works. If you simply then click on right next to Damon, there'll be the term insignia. The term insignia stands for Ormco's non-self-ligating bracket system, just like most other people use, because most people do not use self-ligating brackets. Most people use traditional brackets that you have to tie in with rubber band. So right next to the Damon, you'll see the term insignia. If you click on that, Ormco, from one page to the other, will tell you how much better their insignia bracket is. In other words, their non-self-ligating bracket. They will list bullet point after bullet point after bullet point why it's better than Damon. And it's on the same website. So the question of Damon is interesting to some that have never used it, but it tends to not finish as well. And the Damon bracket, the self-ligating bracket, is not just the self-ligating bracket. It is actually a system. It's not just the Damon bracket, it's the Damon system. And those two are, kind of non-interchangeable. So it's a broad topic. And I would say, just for fun, go to the Ormco website and click on those two, Damon and insignia, and just read down. And it's pretty self-explanatory on those two. They are saying that self-ligating brackets are faster, less damaging. Yeah, advertising, right? And I would say to this, why does Ormco, who makes Damon, say that insignia is better? And insignia is not. Insignia is not a self-ligating bracket system. It literally will tell you that insignia is a better way to treat patients when you just finish clicking on their Damon bracket system. So go there. It's kind of fun. It is fun. It's interesting it's an interesting read. Okay. 3D.
Can I say one thing, Dr. Viviano, really quick?
Sure, go ahead.
Yeah, if you guys please wouldn't mind rename your full name, first and last name, in order for us to issue your CE credits and send them to you, we would need the full name. So if it says iPhone, I wouldn't be able to send you your CE credits. If you could please do that, we would really appreciate it, and it makes it easy. Thank you very much.
All right, thanks, guys. Next question: how often do orthodontists do expanders like RPE? A lot. And rapid palate expanders are not the only expander that there is. There's a lot of different types of expanders, but ortho expansion in the mixed dentition, when the bones of the maxilla are not completely ossified, are very common. So yes, ortho expanders of some type, like RPEs, are done a lot. Could you please explain the difference between high torque and low torque brackets with quick case scenario? That brings up a question as far as bracket design. When you first start progressive, and we're beginning to talk about the best way to treat these patients, you also have to talk about the type of brackets that you want to use to best treat these patients. So I guess the best way to explain it is like this. There is a prescription. In other words, there's a standard prescription. The slot that's cut into the bracket is a certain tip and a certain torque, and it's called the Roth prescription. The Roth prescription is the worldwide generic prescription that worldwide orthodontists all over the globe use or can use. And it doesn't matter if you have progressive brackets, it doesn't matter if you have Ormco brackets, it doesn't matter what brand of bracket that you buy, the prescription, the cut of the bracket torque, if it's Roth, it's the same, right? So it doesn't matter the brand. So if you are an orthodontist and you can use a generic bracket like Roth, because the Roth bracket is just that. The Roth bracket was designed to be a generic one-size-fits-all bracket. And if you're an orthodontist and you treat a bunch of patients and you know how to bend wire and you know how to recover from different types of tooth movements that you really don't want to happen, then you can use the generic Roth bracket and you have no problems. If you want a higher level of diagnosis, if you want a higher level of treatment, you're going to use a different type of bracket that has a different cut in the slot. And there's a lot of different names for those. One of the ways to describe it is high or low torque. It's just a name for the bracket slot cut into the bracket differently. Another name for the same exact thing is called variable torque. But if you take any company, whether it's Ormco, Unitech, GAC, Rocky Mountain, any orthodontic company, if you open up their catalog and you go to their bracket section and you start browsing through the bracket section, if they're all going to be generic Roth brackets. Then when you continue to kind of scroll through their section of brackets, you're going to get to a different section, and it's going to say something like high torque, variable torque, and it's going to start to describe a higher level of design, a higher level of treatment planning, a better bracket, even a more expensive bracket, right? So if you want to use their best bracket, you're going to use a variable torque bracket, high, low, that type of thing. So to give an example, and some of you may not understand this, but you start to get all of this information, obviously, when you start to study ortho. When you're moving teeth around, they're going to do certain things that you don't necessarily like. So if you have a very simple case that's, let's say, a little bit of class 2, and it's going to be a non-extraction case, to treat that case, you're going to wear something called an elastic. And that elastic is going to go from a lower molar to a hook on the upper wire. It's going to be in this direction, from the lower to the upper in this direction. So the force that the teeth are going to feel, the upper teeth are going to feel a retracting force because the rubber band is pulling back. And the lower teeth are going to feel an advancing force because the rubber band is pulling them forward. So the upper and the lower arches are feeling totally different forces. Upper arch is coming back, lower arch is going forward because you're wearing these elastics. So the upper teeth want to detorque. The upper teeth, in fact, this is a good example. The upper teeth want to detorque. To prevent this tooth from detorquing, what you use is a high torque bracket on that tooth. And you prevent the inadvertent movement. You prevent the movement that you don't want, the detorque, simply by changing the bracket design. Now, the nice thing about Smilestream is when you're doing the analysis, when you're you know, all of those pages that I showed you, as far as the bracket design, the DCAD and the SAP and the model measure. Well, integrated into that, Smilestream is looking at what you're telling it, and it's recognizing that you have a situation where the upper teeth are going to detorque. So it will automatically say, hey, your best bracket for this is going to be a high torque bracket. And then you simply order that high torque bracket when you order your case. So the progressive bracket, it's called IP. That's just the name. It's the same as like Damon bracket or, you know, other bracket designs like, okay, losing it. Each bracket that the company makes, you know, has its own little, you know, designation. The bracket that POS makes is called IP. So what you would do is you would order a variable torque IP bracket that helps you not get into trouble because your upper incisor is detorquing in a class 2 non-extraction case, right? So, so explain the difference between high and low torque. I hope I did that. And the difference is the slot is cut differently. It's not your generic Roth bracket. The slot is cut at a different angle, and it gives you either high torque or low torque. And what that is designed to do is to help you during the mechanics. It makes your mechanics treat better. It makes your mechanics treat faster, and it makes your mechanics you don't get into as many problems because you're using the proper bracket. The insignia system you're talking about, is it a traditional bracket system? Yes, it is. That was the point I was trying to make. The insignia system is a traditional bracket system. It's a variable torque system, and it's very good. The insignia system is very good, but the insignia system, to buy the insignia brackets, will cost you about $1,000. To buy the same thing, the exact same thing from Progressive, their variable torque system, it will cost you about $175 for the brackets. So, you know, no. Insignia system is a traditional system. Yeah, it's a system where you have to tie in. So another question says, I see some orthodontists place brackets not in the middle of the tooth, for example. Some place it more towards the edge, some place it more gingival, some place it more incisal. Exactly. The reason why they do that is because they know what they're treating. They know that they need to place the bracket more to the incisal, or they need to place the bracket more to the gingival, or maybe even skew it to the mesial or to the distal. They know how they want the tooth to move, and they know how it's going to move. They're orthodontists that do this a lot. So what Smilestream will do for you, another thing, right, is Smilestream recognizes if you have a very deep bite case. It recognizes it because you told it that you have a deep bite case, or you have an open bite case. It recognizes that, and it will automatically tell you where to place the bracket. The software, as long as you are classifying the case and looking at the case correctly, and you're telling Smilestream, hey, I have an open bite, it's going to tell you where to place the brackets. So it's another thing that a software like Smilestream will do for you, to your benefit, because it knows behind the scenes when you are, classifying your case, it knows what type of case you have, and it's doing all of these really nice things for you. And when you download your treatment plan and your treatments, or your appliance design, your brackets, it's already going to have some of these populated for you based on what you've told it you have, like an open bite where you put a more gingival, or a deep bite where you put a more incisal. That's the reason why they do that. If you have an open bite, you want the brackets more to the gingival of the tooth because it helps close the bite. If you have a deep bite, you want it more to the incisal because it helps open the bite. Okay. So I think I went through all the questions. Does anybody that's listening, do you have any more? You can unmute yourself and just ask.